During this edition of Real Talk, Real Change, join us as we tackle issues related to COVID-19, birthing while Black, and the disparity of Black doctors in this country. Why do so many Black people distrust the medical system?
We need bills and budgets written by Black women. We are not seen.
Black women are the most disrespected, unprotected women, that exist.
We are not heard.
What I'm trying to tell you, you don't really hear, because I didn't say it in a way you could hear it.
And we are not believed.
We were ignored, we were talked down to, we were given a runaround. It was far too late.
Why is this happening?
My precious daughter walks into the hospital and she never walks out.
How can we heal the racial divide and improve the birth experiences for Black women in America?
Just her tone with me, there was something lacking there.
We want to make sure that every birthing person in this country has a choice.
Is there stigma in the Black community around therapy?
They didn't want to be perceived as crazy.
What would be the boldest change that a Biden administration and this Congress could make?
This is a crisis that has only been made worse by this pandemic.
I think we should see color and we should prioritize care based on those risk factors.
What would happen if we created all Black hospitals?
Black babies getting cared for by Black doctors do a lot better.
To me, the solution is people just need to stop being racist.
If the diagnosis is the need for Black doctors, how do we fill that prescription? Welcome to a powerful new series called Real Talk, Real Change. I'm Carlos Watson. Now, I've got a great episode for you, working with my friends at Chevrolet to bring you some of the most interesting thought leaders and cultural voices from all around the globe to talk about what it takes to create lasting change in America. Now, today we're taking on one of the most important issues that we all face. Of course, that's our health. This issue is important to me. In fact, it's personal because I've experienced the pain of losing a loved one due to what I believe was poor medical care. I'll share my story with you a little later in the show. I'm also going to call on you to get involved and to be a part of the change that you want to see in the medical community. Hey, this is going to be a bold conversation with bold consequences on the line. This is Real Talk, Real Change.
You're broken down and tired.
I just want my pain to end, and I maintain if I was white, I wouldn't have to go through that.
We're now a year into the pandemic, and we all know that Blacks are 3 times more likely to get the virus than whites.
We saw this huge disparity in the infection and even the death rates were both Blacks and Hispanics.
It should make us mad because people should walk into a hospital feeling safe.
And we'll rise up.
Scientists have raced to get a vaccine in the arms of Americans, but many Black and brown people are refusing to take it.
There are a couple of things about it that worry people.
Why do so many Black people distrust the medical system? The answer is rooted in horrific abuse that dates back to slavery. There's the infamous Tuskegee experiment, where doctors told Black men that they were being treated for, quote, bad blood, but that was a lie. They deliberately allowed syphilis to progress in the men by withholding treatment from them without their knowledge. The experiment went on for 40 years. The case of Henrietta Lacks, a Black woman who died of cervical cancer in 1951. Doctors harvested her cells for research without her knowledge or consent. James Marion Sims was a 19th century doctor who is known as the father of modern gynecology. He accomplished his medical breakthroughs by practicing excruciating experimental surgeries on enslaved Black women without using anesthesia. And up until just a few years ago, medical books included myths like this one.
Do Black people feel pain the same way as white people? A 2016 study showed that 50% of medical students and residents who were studied thought that Black people couldn't feel pain.
Medical students were taught that Black people have thicker skin or less sensitive nerve endings than whites, so they feel less pain. The pandemic has exposed one of America's dirty little secrets. Turns out it's also a medical emergency that we can no longer ignore.
This is how Black people get killed.
Joining us now, Dr. Jen Ashton and Dr. Jen Caudle. Welcome to you both. It's nice to see you.
Thank you.
Thanks for having me.
Dr. Cuttle, you think that we've hit an inflection point where the combination of things that have happened over the last year fundamentally will create different experiences for patients of color, particularly Black patients?
The systemic and historical racism that brown and Black people have experienced throughout this country over the years in so many different sectors, it literally is sort of widespread. While these are things that I've known about and my community has known about, what I'm really happy to see in this last year more than I've ever seen before is that now the nation is talking about it, and talking about it in a way that I hadn't really heard about before. So even though I know there's a lot of work to be done, I'm hopeful that this is the start of a new day, that this sort of reckoning that we're experiencing will translate to, eliminating racial health disparities.
And Dr. Ashton, what about you? I've spoken to so many friends I know who are not Black in the last couple of years. Has been a revelation. When you see pieces like that, are you surprised?
I've seen firsthand women of color get different care in obstetrics, in gynecology, and it's a bias that most people in the medical field are unaware of themselves. And all I can say is time's up.
Dr. Ashton, how much conversation are you seeing when you're in predominantly white settings? Are they talking about it differently? And do you see any tangible action that is giving you hope?
We have determined that women of color are at higher risk for a plethora of medical conditions, diseases, complications, and they should be prioritized in terms of screening, testing, treatment, and care. The problem comes in this trend that we shouldn't see color. I disagree with that. I think we should see color and we should prioritize care based on those risk factors. The risk really becomes and exists when the medical system says, no, we're going to treat everyone the same. I think just as we should have with COVID, be doing more, not the same, and certainly not less for women of color.
Dr. Cuttle, as wild as that may sound to people right now, what would happen if we created 100 all-Black hospitals around the country that were meant to be top tier, best of the best?
Statistically, Black patients and patients of color do better when their doctor is Black or brown like them. In terms of creating environments to basically prevent maybe the racist and the racism and sort of the inequities that happen, to me, the solution is people just need to stop being racist and start looking at people and communities and individuals the way we really are. And to what Dr. Ashton mentioned, this concept of not seeing color, I think that's a very interesting point because we're always judged by our color. And that's exactly the dichotomy that is the problem here. And
But Jen, see, I think we're saying the same thing only in different ways. I would argue that it would be malpractice if a physician of any color saw a Black person and didn't recognize in a proactive way that Black patient has certain risk factors that a non-Black patient doesn't have. And so I think we're saying the same thing, just different ways.
But there is, and I do agree with you there. We're speaking the same language, but what I want to do is take it a step further, which is I worry that there's not enough physicians and healthcare providers that actually think about that when they see a Black patient.
Yeah, I think if people don't see that, they have been,
But I think many people don't. I think many people don't see that. That clip that was just played that said med students think that Black people don't feel pain. This is exactly the type of mentality. That's the problem, and that's why this year has been so critical. Is because I think for many people, it's been an awakening.
I think that one of the things that we often forget is how emotional this is. It can be difficult, at least for me, and I assume for a lot of us, to engage in these conversations. And I think that there are a lot of people who come to this not just with a knowledge that it needs to be different, but also a real emotional weight to it.
It makes me so mad, and I'm so sorry. Like, this is not, but it just sort of set up a dynamic where you're almost like re-traumatized over and over again, even though you know what's in it. It infuriates me.
Dr. Ashton, I'm going to give you the last word here.
To dovetail on so much that Jen said, I mean, first step in medicine and public health and science is observation, and we know what the observed issues are. Now we have to address them.
Dr. Ashton, Dr. Cuttle, thank you guys both for joining me today. I really appreciate you.
Such a pleasure. Bye, Jen.
Bye, Jen.
It's still the night shift. just brighter. Still a night out, but everything fits in. Chevrolet, making life's journey just better.
Right now, we're going to hear from some young Black doctors about their experiences navigating race and bias in the system. Take a look at this.
Hi, Carlos. My name is Dr. Russell Uday.
Hi, Carlos. It's Dr. Mulian here.
I'm Dr. Macy Hardley, and I'm an OBGYN resident in New York City. I got into medicine because I wanted to provide the type of comprehensive care that Black people don't get in the medical system in this country.
I grew up in Lake Charles, Louisiana. I had this idea that me and some of my Black classmates could get together in all Black and in our white coats, and we could go to the Whitney Plantation in Edgar, Louisiana. So we took those photos, and they went absolutely viral. So we formed a company where our sole purpose was to raise enough money to help minorities apply to medical school, because we need more Black doctors.
I believe every patient needs to feel as if we can understand where they're coming from and hope to alleviate their problems.
My biggest role model, Dr. Mae Jemison, first Black woman in space, was also a doctor, so it just wasn't that unusual to me. I really think that the way to help increase the number of Black doctors is for other people to also have role models that show them that this is a space where they belong.
It is important to have more Black doctors to be representative of our nation, to be representative of our patients, and to give everyone a chance to be heard.
As we know, COVID-19 has uncovered a much bigger problem in the medical system. One of the more shocking questions has been, why are so many Black and brown moms dying across the country? The answer may surprise you, but first, take a look at this.
I just remember getting up and I couldn't breathe. And I was like, I can't breathe. Like, I couldn't take a deep breath. I started coughing because I couldn't breathe. It hurt so bad. It hurt so bad. And then my stitches broke. And I remember I was in the bathroom with my mom and I was just crying and crying, and she was crying. She's like, you just gotta breathe. And I was like, I can't breathe.
As we continue with our Real Talk, Real Change programming, we turn now to something that has become an urgent crisis for many women in this country: pregnancy. The maternal mortality rate in the U.S. is the highest among developed countries. Women of color are 243% more likely to die from pregnancy or childbirth-related causes. Why is this happening? Experts say the underlying reason is quite simply racism. Bringing a child into the world, it's supposed to be one of the most magical moments in a person's life. But for Black mothers, it can be a devastating nightmare, ending in death.
Black women are the most disrespected, unprotected women, that exist. And that's very true. And no matter how many times we're screaming about our trauma and our experience, it doesn't stick.
Someone who should be experiencing childbirth in its purest form, instead gets trapped in like this crazy healthcare system that doesn't listen to women of color when they talk about discomfort.
And it doesn't matter how much money you make or education you have.
I was so married to my birth plan, but what I did not prepare for was a scenario where everything goes south. Being a professional athlete, I never imagined myself in this situation. There are so many women who do not walk out of the hospital. They are not there to raise their children.
It's like a daily grind to get people to think about maternal health and childbirth and thinking about how to improve a medicalized system that is, systemically racist. We have a lot of work to do, I will say.
How can we heal the racial divide and improve the birth experiences for Black women in America? I want to welcome a few people who know all too well how dangerous pregnancy can be for Black and brown women. Joining me now are Congresswoman Lauren Underwood, Charles Johnson, Sasha Fuller, and Latham Thomas, here to tell their personal stories and share what each is doing to help change this disturbing narrative. Welcome to the show. Congresswoman Underwood, I know you're a nurse by training, but what brought you to this issue? When did you start focusing on Black maternal health?
One of my good friends and classmates from my graduate program at Johns Hopkins, her name was Dr. Shalon Irving, and she was so excited to be having her first daughter in early 2017, but unfortunately she died 3 weeks after delivery, and it was just shocking to me. She died of complications related to high blood pressure, and that story is far too common. In the video, it mentioned that Black women were 3 to 4 times more likely to die from a pregnancy-related complication than white women, but the other statistic is that for every death, there are 70 near misses. So that speaks to a widespread rate of severe morbidity. And it just lets us know that we have a lot more work to do.
Charles Johnson, I want to bring you in here. What brings you to this conversation?
I'm here today out of a deeply painful experience. My wife, Kira, lost her life tragically during the birth of our second son, Langston.
My precious daughter walks into the hospital and she never walks out.
So when we talk about Kira, we're talking about a woman that was exceptionally healthy, who did everything right. And we went into Cedars-Sinai Hospital for what was supposed to be a routine scheduled C-section. And Kira was allowed to bleed internally for more than 10 hours while myself and my family begged and pleaded the staff to take action. We were ignored, we were talked down to, we were given a runaround. And by the time they finally made the decision to take Kira back to surgery, it was far too late. And unfortunately, when this happened to me, I was under the impression that what happened to Kira was an anomaly, that women don't die from giving childbirth in 2016, not in America, right? With all that we have at our disposal. We're in the midst of a maternal mortality crisis in our country that is shameful, not just domestically, but on a global scale as well.
Charles, I'm sorry to hear that. I'm sorry to hear about Kira. Talk to me about the folks who were supposed to be taking good care of her. I can't imagine what you went through in general and during those 10 hours, but what did they say on the other side of that?
Very unfortunately, there was a lot of victim blaming. They tried to assume that maybe Kira had some sort of heart issue that had gone undetected, which through the medical investigation, we discovered that was not the case. Kira was failed by the system at the hospital, their procedures and protocols, they threw out the window. And then more than anything, Carlos, there was just a lack of compassion.
I appreciate, admire, and wish you didn't have to be as composed as you are, because I can't imagine the feelings that must move through you and through others. And to think that you will have to figure out a way to make a way out of no way, as my grandmother used to say. Good thoughts to you. Latham Thomas, thank you for joining us as well. I really appreciate you being a part of this important conversation.
My entry point here is as a birth worker. I founded an organization called Mama Glow. And the work that we do is supporting birthing people along the childbearing continuum, from fertility through postpartum. And at any entry point along the reproductive journey where people have to interface with institutions, there's always going to be a point where we have to address respectful maternity care. The model that we currently have in the States really supports normalizing gaslighting, dismissiveness, violence, and dominance in tone and language. It's a normalization of racist and discriminatory language, power over stance, neglect, lack of consent. And so the work that we're doing with our doulas is really to inform them to be empowered, to be incredible advocates alongside their birthing clients.
What you're saying is so powerful to me. You're really calling for a reimagination of some of the things that we've gotten so used to, whether it's hospitals or insurance providers or what have you. And you're really asking us to kind of think from the ground up, what would we do if we were trying to take the best care of ourselves in one of the wealthiest countries? I appreciate you raising that and raising that consciousness here. Sasha Fuller, it's nice to see you. I'm used to seeing you in a different way because for those who don't know, you're the co-executive producer of this show. And so you're usually on the other side of it. What put you on this side of the camera this time?
When we decided to, do a program and focus on the healthcare system and to talk about birthing while Black and that experience, it made me think of my own. My son is 10 years old. So 10 and a half years ago, someone shared a documentary with me by Ricky Lake, The Business of Being Born. And I thank God that I watched that program. I learned about midwives. I learned about doulas. I learned that a birth can be a beautiful thing and not a horrific thing, and that a woman can be in charge of her birth plan. When I had mentioned these things to my family, they had no idea what these things were. My husband thought, oh my God, are we gonna have the baby in the house, in a barn? Like is the baby gonna be born in a hospital? My first go round, the first midwife I worked with, she was Caucasian, and her tone with me, and Charles, you brought up compassion. There was something lacking there. So I knew that when I was going to have another baby, I searched and I found a midwife who looked like me. And when I tell you that experience was so beautiful, and the way she cared for me and the way she just represented me in the hospital.
You got this. You are strong. You can do anything.
She spoke for me, she prayed for me, and I felt like more women need that.
Congresswoman Underwood, what would be the boldest, most important change that a Biden administration and this Congress could make?
You want to make a change in maternal mortality, you have to address Medicaid. Our legislation, the Mommy Bus, one provision is named after Charles's wife, Kira. Now, within the Mommy Bus, we center Black women, women of color, and want to make sure that every birthing person in this country has a choice. It shouldn't matter whether you're in an urban community or a rural community. You should be able to choose between a physician and a midwife and a doula and a lactation consultant. You should be able to choose between a birthing center or at home or at a hospital. Birthing people should have choices.
Charles, I want to ask you about healing, because for most of us, it's hard to comprehend going through something like you did and then still coming out on the other side and being as positive and as constructive as you clearly are.
The beautiful thing about love is it has the ability to turn pain into power. There's so many things about what happened on April 12th that I wish I could change. There's so many things about the way my life has turned out and the way my life has turned out for my sons that I wish were different. But those things are beyond my control. What I can control is doing everything I can whenever I have an opportunity to make sure that we send other mothers home with their precious babies. And so it's just so much bigger than just my story. We're talking about the Amber Rose Isaacs, and we're talking about the Shaija Washingtons, and we're talking about the Yolanda Clems. I can go on and on and on and talk about and literally call the names of all 800 women that we are losing every single year. And the good news is that we can fix this, and that there are people who are working tremendously hard every single day with you in mind to make our country a better, safer place for mothers and babies.
Charles, part of the power, I know you know this, but just to say this out loud, is there people you don't even know who are taking strength in seeing you be as positive and constructive as you are, and they'll never even get to tell you, but I know that they are. So thank you for being that example, and thank you all for being on the show today. Very grateful to each of you. I hope that in sharing their stories, I hope it's helped each of you and perhaps someone you love. As we continue our conversation on something that has become a birthing epidemic, we now turn to some of our nation's leaders. The crisis demands such urgent attention that some of our legislators are stepping up and taking action. I'm pleased to introduce two very special guests who are leading that effort. Jennifer Carroll Foy, who is running for governor of Virginia, and Senator Cory Booker from New Jersey. Welcome to both of you. Senator Booker, welcome back to the show. It's nice to see you again.
It's great to be back on. Thanks for giving a platform to voices that need to be heard in this conversation especially, and for making this a subject of a dialogue. I really appreciate you, man.
Talk to me about how that issue became something that you were focused on. What brought it to your attention?
I think it's a shameful reality that America is the richest nation on the planet Earth, but overall has one of the highest rates of maternal mortality of the richest nations in the world. And this is a crisis that has only been made worse by this pandemic. And I just made it a mission. It has a number of different bills to do a full court press of ending this nightmare in America.
Delegate Foy, I want to welcome you to the conversation. I know that you've been working on this from a policy perspective, but do I understand you also have a personal experience?
I can tell you that when I was running for delegate, I was pregnant with identical twins. And so right before my primary election, I was at work and I felt something that was strange. So I went to see my doctor during my lunch break. I saw his smile turn to concern, turn to panic. And he looked at me and he said, "Your feet will never hit the ground until these babies are born." Right after that, I was put on hospital bed rest. I, had more pain after birth than during labor. And I kept telling the nurses this, and they sent me home anyway. So I was ignored and my complaints were dismissed, and they just kept pumping me full of prescriptions until I got home and one day fell to my knees because the pain was so egregious. And my husband put me in the car, rushed me to the emergency room, where I was immediately admitted and informed that if I would have stayed home a little while longer, I would have definitely lost my life.
Why do you think your concerns were ignored?
Well, the statistics and the studies are clear. Black women, we are not seen, we are not heard, and we are not believed. And it's costing Black and brown women our lives and our children's lives. And so that's exactly why, and one of the reasons that I'm running for governor, because it's not enough to have bills and budgets written for Black women. We need bills and budgets written by Black women because we bring our personal experiences to bear when we are in these positions.
Are there other countries that have done innovative things in the last decade that we should learn from?
When it comes to the issues of universal pre-K, when it comes to infant mortality rates as well as maternal mortality rates, America is way behind the pack of high-achieving countries in fostering environments, from paid family leave all the way to access to quality health care. And we've got to address those issues. The final thing I'll say is, this is not a Black woman's issue. This is an American issue and a shame we should step up and deal with, overcoming the poverty of empathy and being truly what we should aspire to be as a beloved community. Thank you so much, Carlos.
Senator Booker, thank you for joining us. Delegate Foy, I so appreciate your clarity, your strength, your confidence. You seem comfortable in yourself. Where does that come from?
It comes from my grandmother who raised me, who taught me that if I have it, I have to give it.
Delegate Foy, I'm keeping my eye on you. You've got all kinds of Fannie Lou Hamer, Shirley Chisholm running through you, and I appreciate you being so open and you sharing in that good way. And I wish you well on what I know will be a good and interesting and important campaign.
Thank you for having me.
During this edition of Real Talk, Real Change, we've been uncovering issues surrounding racism and bias in the medical communities of this country. Now, while the concerns are extensive, many of our thought leaders and experts have been examining the problems at large and identifying and crafting real solutions. One such solution is as obvious as it sounds. We need more Black doctors. Take a look at this. If you are Black in America, having a doctor who looks like you could mean the difference between life and death.
Medical professionals are to Black women what police are to Black men.
But where are all the Black doctors?
Some patients will specifically say, I want an African-American specialist.
In the U.S., African Americans make up only about 5% of practicing physicians, and that number drops to 2% for Black women.
And COVID was the incredible disparity that this virus was having on the Black community and on all communities of color, but on the Black community in particular. We were able to see that and highlight it because Dr. Janae Caldoun, who's my chief medical executive, is a Black woman who also is an ER doc.
Studies show that race can indirectly influence the treatment a patient is given due to healthcare inequities and biases that are plaguing the system. But experts say that more Black doctors with cultural competency can be a major part of the solution. If the diagnosis is the need for Black doctors, how do we fill that prescription? I told you at the beginning of the show that this is a subject that's extremely personal to me. got some real skin in the game, as they say, because I've also experienced the pain and the anger that comes when you lose someone you love. For me, that person was my mom. About a decade ago, we moved my mom out from Miami to the Bay Area in California, found she and my dad a house that they loved. A couple years into that, she started to feel ill. Originally, we went and we took her to a larger medical system, but I wanted to do something special for her, so my 3 sisters and I got her what at the time they called a concierge doctor, someone who would really keep their eye on my mom. And of course, we were hoping that we were getting her the best care. Sadly, a few years later, I got a call from my mom, and she said, "Come and pick me up." And she said it in a way that she had never said before and told me that there was something that was deeply wrong. Within about an hour, I could tell that something serious was wrong. She was running serious tests on my mom, and by midway through the day, we found out that my mom had late-stage kidney cancer that had spread. Now, as I later learned, a lot of the symptoms that my mom had, if someone was taking her seriously, were easily observable. And it is heartbreaking to think that when we thought we were taking better care of my mom, maybe in fact we were putting her in the hands of someone who was taking worse care. So I think a lot about that conversation around good care, around the need for more and high quality doctors, and particularly Black doctors. Joining me now is an ally in the fight for more diversity in the medical field. He's developed a program to help educate and empower future doctors from underrepresented communities. Please welcome Dr. Mehmet Oz. Dr. Oz, what would you love to see happen over the next year, 2, 3 that would actually make a real difference?
Cultural differences amongst people, they show up in different ways. One of the most obvious ways is I don't really hear what you're trying to tell me. Or what I'm trying to tell you, you don't really hear because I didn't say it in a way you could hear it. And so that leads to the kinds of atrocious statistics that surround the care of Black people in America. And I actually started wrestle this topic down a little bit, just getting comfortable with the numbers. And I kept thinking, well, okay, I know that Black babies don't live as often as white babies, which is horrible to even acknowledge, but it's just true. What I didn't know that's even worse is that Black babies getting cared for by Black doctors do a lot better than when they have white doctors. And you think to yourself, well, I don't think the white pediatricians, they don't want to hurt those little beautiful gems of life, whatever color they are. So obviously there's something deeper than this. And so within medicine, we've allowed issues to percolate for too long. And we had a great opportunity now to awaken people. We can awaken a group of people who really want to care about this issue.
So talk to me about what change you think would make a difference here, Dr. Oz, because it is heartbreaking.
I think the best way to fix some of the deep cultural blocks that are occurring in American medicine is to have more Black healthcare providers, especially Black doctors. So we started a program called #MoreBlackDoctors. This campaign is designed primarily at high school kids, who I have a big access to because I've got a kids foundation called Health Corps. We raised $100 million for Health Corps. We teach primarily kids in underserved areas about health, but now I want to teach them to go into health. And we're doing that with a lot of Black doctors who never got mentoring, and no one ever told them that there were opportunities. By having more Black doctors in mentorship positions, all of a sudden, all these high school kids start to reimagine their future and the possibility of becoming a doctor.
Dr. Oz, thank you for joining the show and bringing some real solutions to the table. Very much appreciated.
Carlos, congratulations on all your success. I wish you the best and keep talking openly. Ask the questions that need to be answered. God bless.
All right, as we continue the conversation about the need for more Black doctors, I want to welcome 2 very special guests, Dr. James Hildreth and Dr. Alpha Stewart. Dr. Stewart, talk to me a little bit about this need for more Black doctors, because, I thought to myself we were in progressive Bay Area, California. I thought I was finding my mom a terrific doctor. And now I look back on it and I think about how unaware I was, how naive I was, how hopeful I was. Is there a meaningful difference, do you think, for lots of families when it comes to getting a doctor of color versus not having a doctor of color?
I think for many people of color, particularly Black people, there is a significant importance attached to having a doctor who looks like you, is the way it's described. There is the reality that perhaps in a situation like yours, someone who was maybe more culturally in tune, more understanding of how an older Black woman might communicate her challenges and signs and symptoms, perhaps someone with a better understanding culturally might have come to a different conclusion.
Part of the question about change is almost always going to involve a coalition of some sort. What do you hear and how do you think about engaging more of your non-Black colleagues and peers in this question of dramatically increasing the number of Black doctors and medical professionals?
I just wonder whether or not it would be in the best interest of the country for the country to pay for the training of some of the physicians that we need, to take away that financial element of this.
That's interesting, Dr. You're basically calling for something of a GI Bill. So kind of a bold opportunity. I really like that. That would be quite a signal by the country to do that, and relatively inexpensive given all the other things that we are spending money on. I do hope that we can get to a place where more people can live rich and energetic lives, and I appreciate both of you for the contributions that you're making.
It's hard enough to get mental health treatment in the U.S., but studies show that racial and ethnic minorities are significantly less likely to receive mental health treatment than whites.
Making the crisis worse, not enough African American therapists. Today, only 4% of psychologists are Black.
I want to welcome someone into this conversation who can speak to this issue from a very personal perspective. Charlamagne Tha God is a mental health advocate and the co-host of his hit show, The Breakfast Club. Charlamagne, good to see you again.
Carlos, how are you, my brother?
Man, I'm doing well. It's a new year, so I feel like I'm in a different space. What about you?
I'm blessed, Black, and highly favored. I always say that I'm somewhere between O and K, because, some days, I'm feeling great, and then, some days I have things that trigger me and take me back to a low frequency that I don't like being at.
Do you know what triggers you?
Yeah, through therapy, is one thing I realize is that a lot of things that do trigger me are directly tied to something that may have happened in my childhood.
What else has helped you when you think about health and being healthy?
Nowadays, really meditation. Meditation is something that I've been trying to add to my repertoire for years, but I just could never get into that headspace, and it's like when I talk about, things triggering me, when I got to get back to center, I just sit down and I go meditate, and it gets me right back to where I need to be. So for me right now, the biggest thing that's been keeping me mentally healthy and emotionally healthy outside of therapy is definitely meditation.
Talk about therapy and what you have found in that. What have you found when you have found good therapy?
To me, it's just the organization of the mind. And that's why I tell people, man, we got to start getting, social emotional learning, and we got to start, raising the bar on mental health literacy in these public schools, because, man, I didn't start going to therapy till I was like 36, 37 years old. So I had to unpack 30 plus years of trauma, as opposed to if I had started early in like grade school, I could have been unpacking and organizing everything that was going on in my mind then. Would have saved me a lot of trips to the emergency room thinking I was having a heart attack when I was really having panic attack.
Actually, talk about that for a second, because I was about to say that one of the words that I'm hearing used more is word anxiety. Because when I used to hear anxiety, I would largely only hear it from upper middle class white people, even though I think lots of people feel anxiety.
Anxiety is just that irrational, fear that the worst is gonna happen. Because, anxiety is just something in your brain that is often out of your control. I always say anxiety is like Michael Jordan in the 90s. Like, you can't stop it, but you can just hope to contain it.
Talk to me about if you think there is a stigma in the Black community around therapy.
100%. And the reason we have a stigma is because, the people who came before us, and I'm just speaking from personal experience, talking about my father, and my mom, they were going to therapy, but they never had these conversations with me. When I put out my second book, Shook One, I had a younger cousin who committed suicide. And then my dad had read my book, and my dad was like, yo, man, he said, I've been on 10 to 12 different medications throughout my life for my mental health. So even with Black people actually going to therapy back in the day, they were hiding it, because they didn't want to be perceived as crazy. I really, truly do feel like we're the first generation that has the luxury of healing.
What would you love to see happen that would cause more of us to be healthier?
Definitely, the Mental Wealth Alliance, which is a foundation that I launched, we want to raise, $100 million over the next 5 years and partner with, different Black-led organizations and experts. We want to prepare, thousands of Black people to become research and clinical service providers in psychology, social work, by establishing scholarship funds to provide training to increase, the number of mental health care professionals from 4% to 14% to reflect the Black population. I would like to see, more conversations about financial literacy happen. All of that plays into the health aspect, because we got to be mentally, spiritually, emotionally, physically, and financially healthy in order to really thrive on this planet.
Charlamagne, I appreciate what you just said about the financial. I haven't heard anyone else say it, but you and I both know that bad finances can affect your health, not only your physical health, but your mental health. For more, you can check out the Mental Wealth Alliance Foundation and Charlamagne's best-selling book, Shook One, Anxiety Playing Tricks on Me. Charlamagne, really appreciate you, appreciate everything you're doing. Be safe, be well.
Carlos, thank you, my brother. Blessings to you, man. Appreciate you.
My heartfelt thanks to all of our guests who joined the conversation today and to all of you for tuning in. This is only the beginning. In order to reset America, we've got to reset America's healthcare system. It'll take all of us working together to turn this crisis around, but I remain confident, even optimistic, that brick by brick, we can rebuild this country, we can reset America. Step up and be a powerful health advocate for someone you love. Make sure their voice is heard and fight for them, especially when they can't fight for themselves. Take it from me, it's a lesson you don't want to learn too late. The time is now. Together, let's create a future where medical racism is a thing of the past and not the thing that continues to make us sick. Thank you to all of my guests and all of my good friends at Chevrolet and to all of you for listening and sharing your stories. Be sure to go to OZY.com/Real Talk to be a part of the conversation. Thanks for watching Real Talk, Real Change.